County Executive Mark Elridge. I'm giving everybody permission to record, and then we'll get started.
Hello, everybody. Good afternoon, and welcome to our weekly COVID-19 public health update with Montgomery County Executive Mark Elridge. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today as well is Dr. Earl Stoddard, who is the acting Assistant Chief Administrative Officer for the county. Reporters, all of you should have permission to record. You already heard. If you do not, use the chat to request it. And with that, let's get started. Mr. County Executive, good afternoon.
So good afternoon, everyone, and thank you for joining us on our weekly briefing. I'll start with our COVID update. There are some other things we'll be talking about as well. I want to start by letting you know that our positivity rate today was 3%, and the case rate was 75.7 per 100,000. We had 130 new cases yesterday, and we had 6 new hospitalizations and 1 death. We remain in the substantial transmission category according to the CDC guidelines. And beginning last Saturday, we mandated masking in indoor public settings for those vaccinated and unvaccinated when the county's rate is in this transmission rate is in this category. I want to thank the County Council that, sitting as the Board of Health, unanimously supported our recommendations. This masking mandate will remain in Montgomery County until we can lower our transmission rate to moderate for 7 consecutive days. The growing transmission of the Delta variant is motivating some of us who are unvaccinated to finally see the light, but it's not enough. There are still far too many, probably over 200,000 unvaccinated people in this county. When they get sick, and if they don't wear masks and they initially don't know they're sick, is one of the calling cards of this virus, they are helping to spread this throughout the community. It not only spreads to people who aren't vaccinated, but we continue to see breakthrough cases in the county. Those are cases where people who've been vaccinated are now getting COVID. So this is not just simply a matter of you don't feel like getting vaccinated and that's a personal decision for you. Your decision is affecting the health and well-being of other people in this county. We are planning on opening schools. I think everybody knows in September and bringing the kids back into classes. We do not need adults spreading COVID and infecting children who will then come into schools and spread that through the classrooms. So I implore people to please get vaccinated. There's no chip. You're not going to become sterile. You know, people are not dying from getting vaccinated. We need people to sign on and get vaccinated and think about not only themselves, but think about everybody else in this community. And hopefully more of you will take that guidance. There are thousands of jurisdictions in this country that would love to have vaccination rates like ours. And yet we still have another week of increased cases. We've been the highest vaccinated jurisdiction of more than 300,000 people for a while now. I want to send a clear message about what we need to do. Delta variant is transmitting 5 times faster than previous variants. what we do is critical. And I think if you read the news stories, you're reading about what's happening in Texas and Florida, and hospitals again being overwhelmed. Florida had more people in hospitals than they did at the height of the original pandemic. So this is not something that should be taken lightly. And it's clear that the more people are vaccinated, the less people will get sick or be able to pass on the virus. And as this virus continues to pass through our region, we have to consider other ways to incentivize folks to get vaccinated. So we're having discussions with other regional leaders, and I support the development of a regional or statewide vaccination passport. It wouldn't do us any good just to do it in one county, but if the regional leaders are interested, and I know some of them might be, doing this together as a collective action would help make all of our residents safer. If vaccine passports are required in Montgomery County, over 85% of adults would still be able to go to restaurants, movie theaters, and everything else. So this would not have much of a hit on businesses. What it would do is prevent people who aren't vaccinated from going into those settings. We are hoping to work with our neighbors in this region, and hopefully we'll be able to make something happen. I want to shift gears a little bit and talk about the UN climate change report and its relevance to Montgomery County. We have another health threat this week, which is the heat we're feeling. We're expecting temperatures to break 105 today. Residents who are looking for cool places to go should consider buses, rec centers, libraries, regional service centers. The heat we're feeling this week is only going to get worse and worse year after year. It's pretty clear that something in the climate is radically changing. We just can look at the fires in California. We can look at the floods. We've had our own unprecedented amounts of large storms. This is a reality. The UN report that was released earlier this week notes that human-induced climate change is already affecting many weather and climate extremes in every region across the globe. The scale of recent changes across the climate system and the events we are witnessing are unprecedented. And we see them and we read about them every day, and it is alarming. As I've said before, if Covet hadn't completely dominated the news cycle over the past 18 months or so, the rapidly deteriorating climate situation and the worsening projections for negative impacts of climate change would have been the year's top story. And we need to bring the same determination to fight climate change as we brought to fighting COVID. It's simply time we face reality, that only we can end climate change. Nobody else is going to do it for us. This is the sum of our actions and the actions you enable your governments to take that are going to make it possible to defeat climate change, or at least rein it in somewhat. Doing nothing is not an option. It's certainly not an option if you care about your children and your grandchildren. So I'm hoping that we'll continue to come together and work together to fight climate change within our own boundaries. Earlier this summer, I released Montgomery County's Climate Action Plan. It's our county's strategic roadmap to eliminating greenhouse gas emissions and achieving our climate goals, which are very aggressive: 80% greenhouse gas emissions by 2027, 100% by 2035, put them among the most ambitious in the country and the world. I will not tell you this is going to be easy, but there are ways forward, and we've mapped out the direction that we can take that could get us there. We don't have the luxury of waiting for others to lead anymore. We have to do what we need to do, and hopefully others will follow. The Climate Action Plan identifies 86 actions the county has to address by 2035, and we're implementing 75 of them, or beginning to work on 75 of them in this year's action plan. The strategies we outlined take into account those in our community who are most vulnerable. As we address the impacts of climate change, one of the dilemmas we have is requiring older buildings to meet newer codes, and we understand that's not something that's going to come without cost, and we need to make sure that we can help support that change so that we don't have many of our lower income tenants actually losing their housing as we try to fight climate change. That would not be a good outcome either. It's my hope that others will wake up to the urgency of the situation. It would certainly make our job easier. We need state and federal governments to be our partners, and one of our goals, the electrification of the grid, is very difficult to do locally, but if the state were to move its timeline from 2045 to 2035, our task and what we could accomplish becomes a whole lot simpler. So there's a real value in all of us working together on this. Many of the actions that we've put forward are going to require a comparable action by the county council. We've sent over the Building Energy Performance Standard legislation, we call it BEPS, and the updated Green Building Code, and we're awaiting council votes. Between new buildings and existing buildings, they generate over 50% of our greenhouse gas emissions. And if we don't pass these measures, there's simply no path to our climate goals. It's that simple. If you don't deal with the 50% of greenhouse gas emissions that are coming out of our built environment, you cannot say you have climate goals. So we're going to encourage and working with the council to get this legislation passed. In the case of the International Green Building Code, all they have to do is approve the executive regulations. Changes in federal state policies, obviously some of the stuff you're seeing out of the Biden administration are of great interest to us. Anything they can do in helping on transportation and on energy production will certainly help us get to our goals. Speaking of bad environmental projects, I testified at the Board of Public Works today on the continuing story about I-270 and 95. The vote is up sometime today, probably mid-afternoon, on the governor's proposal to move to the next step. And just want to explain to people what I said today. I was joined by many other elected leaders. There's a letter from 78 of the state delegates and senators in supporting this position. We were supported by 4 members of the county council, and even the other 5 modified their support to at least require that the report that Nancy Kopp was supposed to be able to do on the legal issues and the bond financing, but was prevented from doing because the governor wouldn't give her the $100,000 for the report. The council's even said that needs to be done before they move forward. And we're hoping that the state listens to this. This is a 3-person vote, basically Nancy Kopp, Peter Franchot, and the governor. So the stuff we emphasized was, first, that this is not a solution for 270 and the Beltway. You can't say that when the project stops at the ICC. The state's own study shows that the traffic gets worse going north. Once you if you're going northbound on this map, which is from Rockville to Frederick, at the end of the toll lanes, we go from 8 lanes to 6 lanes. In Gaithersburg, we go from 6 lanes to 5 lanes. In Germantown, we go from 5 lanes to 3 lanes. And from Clarksburg, we go from 3 lanes to 2 lanes up to Frederick. This is going to make traffic worse. When they start trying to run 8 lanes into 6 lanes at the ICC, you're looking at an amazing bottleneck. The state study shows that bottleneck at that point, and that's going to congest this road all the way up. So what we asked the state to do, I asked this last week at the COG meeting 2 weeks ago, I guess, that the state commit to a single project from the American Legion Bridge all the way up to Frederick. A single project, not something that they'll get around to a decade from now. I reminded the governor that I had, initially at least acknowledged that he was willing to tackle this problem in this quarter and that it was the right thing to do to try to tackle the problem. We disagree somewhat on how exactly to do it, and there's issues about the financing, but we need to continue to work with them. We believe and continue to believe, and this is a position going back to when O'Malley was governor, so anybody who thinks this is partisan, we're being pretty consistent. We supported 2-lane reversibles. The state's saying that their traffic studies show that by 2035 we might need more than 2-lane reversibles. And our point has been that any traffic study done before COVID that does not address a changing world in which more and more people are likely to be telecommuting is not this traffic study that you can rely on. And it would nothing be worse than building more pavement and more asphalt than you need to do to get the job done. It's hard enough that we have to expand the road. Expanding it more than it needs to be done is not helpful. We support giving Treasurer Kopp the funds to complete the report. We also want the legislative report, which was supposed to be produced, that would analyze whether or not it's even necessary to use a P3 agreement for financing. That we should get that report before the Board of Public Works moves forward. And, I remembered that when I was first on the council and talking about the bus rapid transit system, Roger Berliner and I had a meeting down with Undersecretary Rogoff for Transportation in DC, and we talked about how we'd fund the project, and we mentioned P3s, and the Undersecretary said, you can do a P3, but don't do it for financing, because the government can borrow money for less than the private sector is going to borrow money for, and you're going to pay them to borrow the money, and you're going to pay them to pay back the money. Whereas if you borrow the money, it will cost you less to do that. So we don't understand why the governor is not willing to look at whether or not the state can finance it. And finally, we don't understand that given that Congress is passing a record infrastructure bill designed to build badly needed infrastructure in the United States, why he wouldn't take a bridge which connects two interstate highways, why he wouldn't bring that project forward to the federal government as a candidate for funding. We got 30 to 40% of the funds for the Woodrow Wilson Bridge out of the federal government. We could do the same thing here, quite possibly. And that could have a significant impact. If you're going to do toll lanes, it could have a significant impact on how high the tolls have to be. So we kind of laid out where we want to be. We do think it's ironic that there's this juxtaposition of the BPW, Board of Public Works, being asked to vote on this today, the day after the Senate passes this infrastructure bill. We think there's a way forward. As recently as 2 weeks ago, maybe 3, I had a 2-hour meeting with Greg Slater, the governor's Secretary of Transportation. So we've been working, we're trying to get this project done, but we want to get it done right. And we want to make sure it serves all Montgomery County residents. The people aren't being told they're going to get one thing, and then 5 years from now, they'll be staring out there and wondering where the other half of it is. I do want to thank our congressional delegation, particularly our senators right now, Chris Van Hollen and Ben Cardin, for getting that infrastructure bill through Congress. It passed with 69 votes. I don't think anybody originally anticipated this thing passing with 69 votes. It's a good sign that there are things that can get done, and this is a lot of money for infrastructure in this country that's going to make a big difference. And some of it will wind up making a difference in Montgomery County, but it's going to make a difference all over the country. I want to note that yesterday was the 5th anniversary of the fire at the Flower Branch Apartments. 7 lives were lost there in the fire that was caused by a gas leak and a faulty mercury gas regulator. Now there is state regulation, the Flower Branch Act, that was introduced by Delegate Lord Chargoodian, requiring the gas regulators be placed outside and moved outside if they're currently inside. And finally, I want to say that last night, as part of our summer small business tour, I stopped by Hank Diedel's Tavern in North Bethesda to welcome them back. They are a very old Montgomery County institution, about 100 years old, worth of old. And they were the first place I legally drank in Montgomery County back when that happened. For music lovers in the DMV, Hank Diedel's Tavern's been an institution. They had music last night, and they're having regular music, and they have food now. So if anybody went there in the old days, when they didn't have food, and in the later days they had food trucks, they're actually preparing food there now. So it's great to see them back. It was sad they closed, but because of a lot of support from the community, they did a lot of fundraising, and they were able to open their doors back up. So it was just a nice thing to end my night last night, to see the revival of that tavern and to see it full of people and music. And I'll stop there.
Thank you, Mr. County Executive. Dr. Stoddard.
Good afternoon. Thanks, everyone. And I won't cover all the same ground the county executive did. Just a reminder, we had 130 new cases today, 6 new hospitalizations, 1 death. Over the last 7 days, and as we track, that's the CDC target numbers that we've been utilizing for determining transmission. We're at 78.7 per 100,000 over the last 7 days. That's defined as substantial transmission. Our test positivity over the last 7 days has been 3.1%, so it's, 0.1% higher than it was on the individual day today. I do want to talk a little bit about hospitalizations. We've gotten a lot of questions about hospitalizations, and I think some of this data will explain sort of what we're seeing. So over the last 4 weeks, there's been, I think, 1,675 cases. 618 of those have been defined as a breakthrough case. So about I think 29% have had 2 doses of the vaccine, 4% have had a single dose, or 4% had the 1 dose of Johnson & Johnson vaccine. 63% of the cases over the last 4 weeks were unvaccinated. Now, the important thing for context here is that as our vaccinated population continues to increase, we're actually getting about 5,000 to 6,000 vaccinations per week at this point still. Which is lower than we'd like it to be, but it's been a steady climb over the last month or so as more people have been recognizing the threat of Delta variant. But that translates to 0.075% of vaccinated residents have tested positive for COVID-19 over the last 4 weeks. That's a very small number. Hospitalizations, we've had 66 hospitalizations over the last 4 weeks total. 22 of those are amongst vaccinated residents, and of those 22, 73% of the vaccinated residents who've been hospitalized are over the age of 60. And so obviously it continues to be the highest concern for our older population, and that's reflected in who you see getting hospitalized. I think it's key to understand that in the hospitalizations that sometimes what happens is the person is admitted to the hospital for example, heart attack. And in the course of their intake process, they end up testing positive for COVID-19. So it becomes unclear whether the heart attack and COVID-19 diagnosis are in any way related, but because they're being hospitalized for the heart attack, they're often characterized as well because of their COVID infection. So it's important to understand that even amongst our older population, we're not seeing as severe cases. We're seeing that reflected in not seeing high level of ICU and ICU utilization. But obviously, we've seen, I think, 0.2% of our hospital beds were being utilized for COVID-19 as of the first week of July. We're up to 2.3%, which obviously is still very low, and we're happy it's very low. We expect it to stay low, but we're seeing an uptick in hospitalizations. Just, we're trying to balance out giving the numbers, being forthright about it, but also explaining that there is still a very low rate of hospitalization for COVID-19, particularly amongst our vaccinated population, but even across the board. And so we've gotten a lot of questions about hospitalization, and we're not seeing the uptick that you're seeing in Florida, Arkansas, Louisiana, Texas, et cetera. We obviously don't want to get there, and we know that cases hospitalizations do lag cases, but we're not seeing a significant uptick in hospitalizations, nor do we expect it with our vaccination rate. Continue to get people vaccinated, as I said, and I think we're focused a lot on making sure there are opportunities for students, faculty, and staff in the school systems to get vaccinated over the coming weeks before school starts. I'm pleased to say that my daughter turned 12 yesterday. She received her first dose of the Pfizer vaccine at noon today. So obviously we continue to add more people on as they age into that category. And we're hopeful that as the FDA reviews the data for under 12, that new students become eligible and can be vaccinated, making our school environment even safer for the fall. So I think I will stop there. I think we're happy to entertain some questions.
Thank you, Dr. Stoddard. First question coming from Jack Moore, WTOP, and it is for you, Mr. County Executive. Jack?
Yes, on the question of a regional vaccine passport, can you provide a bit more detail? Kind of, are those discussions and negotiations, have they already begun, or is this something that you would like to do, or have they already begun? And who are you talking to? Who would be, who would you consider part of the program?
Mark, you're muted.
Yeah, you need to unmute me, Mr. County Executive.
There. Sorry about that. I don't want to throw anybody under the bus prematurely unless Dr. Stoddard wants to elaborate any, but there are people who are interested, but there's a reluctance to do it on a jurisdiction by jurisdiction basis. And so I understand there's going to be a meeting later this week to talk about what we might be able to do. And I'm in agreement with those who think if we do it, it ought to be done on a larger basis than just one county. So stay tuned. I mean, we're not announcing anything for the council to take action on next week at this point. So we'll see how this evolves.
I would just,
Oh, sorry.
sorry, I was just going to add that the Council of Governments obviously is, sort of the regional convener on many of these issues, and they'll be sort of the conduit through which these conversations will happen. Yeah, I think that is what we're expecting is, it's hard to describe exactly how those conversations will go out, but there are certainly people interested in investigating, and we're interested in investigating as well. And we think that because of how connected our region is, it obviously makes the most sense for it to be a regional effort if it's going to happen.
And have you heard support from businesses? Is this something that they would want? Some organizations have already kind of announced their own plans. So do some want there to be a standardized thing so they're not kind of out on a ledge?
I've actually heard from some people who'd like that. For one thing, it would make their other customers more comfortable. I mean, the thing about, in a restaurant, I think it's sunk in with everybody is that even though, we're supposed to wear masks indoors, it's meaningless in a restaurant because you're eating. And so people are staying away from places if they feel vulnerable. And, the news that there are breakthrough cases doesn't make people feel more comfortable. So I suspect with our high number of adults vaccinated, that the places that we would impose such a mandate, their owners would be thrilled because they could, tell their patrons that everybody in this place has been vaccinated. That would be a big deal, I think.
I think it's like anything else too. You're going to see people, many businesses who support it and encourage it and think it would be great for their business. You're going to see others that they believe, but because of the customer base that they have, that it would be more harmful than helpful. And I think there'll be a mixed bag of businesses, as there is in all of these. Some who are supportive of certain measures, some who are opposed to certain measures, and that's what we would expect. But obviously, I think the key is we want to, number one, protect our residents, but number two, the thing a vaccine passport surely does, and this is evidenced by what's happening in New York City now, is you see a massive uptick in vaccination rates because people feel the inconvenience of not being able to do the things that they want to do, and finally acquiesce and decide that the vaccine is something that they'll do. So obviously it serves two purposes: protecting the people who go to the businesses, but also encouraging those who have not been vaccinated to be vaccinated.
I'll just add, this is not such a strange thing to do. I mean, schools have vaccine requirements for students, because we know there are people who are scrambling around to get their kids vaccinated before they start school. So it's not like we don't in other areas decide that it's not safe for unvaccinated people to come into a setting and then say you have to be vaccinated to come there. So we're not entering new ground with this.
And one quick follow-up. Sorry, the meeting later this week, that will be convened by the Council of Governments?
Yes.
Thank you.
Thank you, Jack. The next set of questions from Dan Shear, Bethesda Beat. Dan, good afternoon.
Hi, this is either for the county executive or Dr. Stoddard can respond, but I was wondering if there's been any consideration of re-implementing any capacity restrictions for restaurants, businesses.
I can start it unless Mark, you want to. No, we're not interested in going down that road at this point. There have been no conversations to the effect of even setting thresholds when we consider that. I would say, generally speaking, and having spoken to Dr. Gales about this, we both agree that hospitalizations we'd have to see a change in that arena before we really even considered anything along those lines. I don't think we're going to go down that road, nor do I think the county council, sitting as the Board of Health, has the appetite or desire to go down that road. So I don't expect that we're going to see those coming back unless we saw a marked shift in our COVID numbers, most specifically relating to hospitalizations, ICU admittance, things of that nature. So long as we can keep the cases reasonably under control and not see a huge uptick in hospitalizations, I don't think we're going to go down that road. And that's inclusive of gathering limits, occupancy limits, all those things. I just don't see it happening.
Got it, Dan?
Yep,
Thank
thanks.
you. Thank you. Randy Bass with WDVM has a question for both of you. Randy, good afternoon.
Good afternoon. Thanks for having me on the briefing today. I wanted to open this particular question up to both of you. At this point, what do you think it's going to take to get unvaccinated, vaccinated? Is it an issue of hesitancy, or are you still hearing the issue of access?
I could not hear you.
Yeah, Randy, I think you're really quiet. You definitely may need to be louder.
Hello, can you hear me better now?
Yes.
Okay, so can my entire apartment building. Okay, so here's what we're talking about. I asked, what will it take to get the unvaccinated vaccinated? At this point, is it still an issue of hesitancy, or is it an issue of access? What are you all hearing right now?
Look, I don't think it's access. I mean, to me, it's hesitancy. You know, part of it's age. I mean, when we put out a number, you know, if I used a little over 200,000, you know, almost half of that's kids under the age of 12. So it's really, you know, a smaller universe of people this applies to. And, you know, we have no shortage of vaccine. We could vaccinate everybody who wants to get vaccinated. We've got the places to vaccinate them. I think we're at a point of people just resisting getting vaccinated. But, you know, it's interesting. If you one way, I look at the older group, which is like 98 or 99% vaccinated. When you get numbers like that, in that group anyway, politics, race, and gender are not factoring into their vaccine decision. They're just, you know, old enough and wise enough to say, yeah, we think we all need to do this. I just think there's irrational hesitancy from some people.
And I will also say, and we've talked about this before, so we are continuing to see the trends in terms of race and ethnicity continue as they have, which is that the Latino population is actually running 10 points ahead of our white population in Montgomery County. And we're now down to a 5-point gap to where Blacks or African Americans are 5 points below the white residents, which I think 2 weeks ago when we reported that was 7% or 8%. And so it just shows you that we're continuing to move towards a trend where things are normalizing by race and ethnicity. But I will say that I think national polling does bear this out, that what you have left is largely people who are either apathetic about getting vaccinated and just don't see the reason to. They're mostly young, 21 to 40-year-old persons, more men than women not wanting to be vaccinated. They say largely that I just don't see the need for me to get vaccinated. I'm young and healthy otherwise, and I probably won't get vaccinated. What you see is some of them are pretty dug in. 40 to 50% are saying there's nothing you can do that's going to make me want to get vaccinated or make me get vaccinated. The other, let's say 50% or so say if I were required to do vaccination because of my job, or if I couldn't do the activities that I enjoyed if I wasn't vaccinated, that might drive me to be vaccinated. And so I think we're talking, we're still continuing our messaging efforts, and I think we'll be able to get down a few percent here. Like we're getting 5,000 to 6,000 people getting vaccinated every week. That's not a huge number in a population of 1 million plus, but our vaccination rates are quite high, so it's still some progress every week. We do think that like the county executive said, a vaccine passport might assist in driving those numbers up further. The big assistance will come when we can make the younger populations eligible, because we know that parents are anxious to have their children be vaccinated for protections in schools and other things. So I think that will be the biggest next impact, is when we see those 11 and unders become eligible. But in the interim, we do think that people being having some of the activities that they like to do be tied to their vaccination status would drive up the numbers in a way that simple messaging would not.
Each of you going, I appreciate, can you all hear me? Hello? Hello?
Thank you, Randy. Randy, you're kind of breaking your sound. We are having difficulty listening to you. You want to get closer to your device?
Can you hear me now?
Yeah.
Much better, yes.
Sorry about that. I do not know what's going on today. Just one follow-up. Thank you both for going more in depth on that question I just asked. I appreciate that insight. I guess when we were talking about the 11 and unders, would those kids not be able to go, hypothetically, would those kids not be able to go with their vaccinated parents to a restaurant if vaccine passports became a more widespread thing? Would they just not be allowed to go?
Most places that have been so first off, it would all come down to how the program was designed. In most places, I think New York City being the best example of the place that's moved the farthest along on this, is those who are ineligible are not considered in terms of being required to show vaccination. So children under the age of 12 would not require to demonstrate their vaccination status, so therefore they would be able to attend. But again, we're in the infancy of the conversation in the National Capital Region. I don't even know that it's going to necessarily happen. I don't want to say that it's definitely going to happen because these are ongoing conversations. But I would think, based on the way it's been done in other places, that you would not apply it to those who are ineligible for the vaccine.
And I would agree with that.
Thank you, Randy.
Thank you both.
Thank you. I do not see any more questions from members of the media on the chat. Reporters, going once, going twice. I think we're done for today. Thank you, everybody, for joining us. Stay safe. We'll see you next time.
Thank you. Bye.